Welcome to City and State TV. I'm Executive Editor Michael Johnson. I'm joined today by David Rivel, CEO of the Jewish Board of Family and Children's Services. Now, back in March, one of New York City's largest social service nonprofits, Federation Employment and Guidance Services, or FEGS, filed for bankruptcy. And this was after reporting that they had lost almost $19 million in 2014. That left a huge gap in social services, and I know you guys have now stepped in to take over a large chunk of that, completing that transfer this week. So that's why we wanted to bring you in. So tell us a little bit about what happened here and what's going on with the transfer. What services are you taking over?
Sure. Well, all of the programs of FEGS have landed safely with other providers. The Jewish Board ended up taking the largest single piece of the portfolio, collectively known as behavioral health programs, mostly for adults with histories of homelessness, drug abuse, mental illness. The state decided very early in the process that for the benefit of the clients, they wanted to keep all of those programs together and transfer them all to one provider. So in January, they did an internal analysis and they took a look at the different nonprofits that might be able to take over the portfolio, and Jewish Board, they said, came out number one in their analysis, actually by a fairly wide margin, and we were contacted and asked if we would be willing to take over these programs, $75 million of programs in all.
And that was roughly, I think it was $250 million of programs is what FEGS was doing before, so that's a large bulk of it that you took over. Talk us through a little bit about the chaotic situation, I guess, in January and throughout the first half of this year in applying to take over these contracts, working with the state officials mostly to try to take over. What was the biggest challenge in that? Because I'm assuming that in January, when people saw that this was happening and that there was this huge loss and that they weren't financially solvent to be able to do this stuff, a lot of people panicked. I mean, this is a safety net for a lot of people. So how did this play out, and what was like the challenges that you had to work through to make sure that this happened and people were able to get the services that they need going forward?
Right. Well, very quickly we had to do a feasibility study to figure out if we could take on these programs. And if we did, what would be our operational plan to make sure it happened smoothly? The state wanted us to take programs over as of June 1st. The city later called us and said they also wanted to give all of the city behavioral health contracts to us. Nassau and Suffolk counties also contacted us and said they wanted those local contracts to come to us also. So there were a lot of programs that had to transfer pretty quickly. So we had to figure out a game plan to make it work. And we sat down with our board, everyone on our senior staff, and we tried to figure out all the operational details that it would take to make this happen. Because FEGS was going through bankruptcy, none of the assets that would normally be available to us in a transfer like this were available to us. So for example, in the portfolio, there are about 800 staff people delivering programs. All those staff people needed new computers. All those computers needed to be loaded with software. They needed furniture. They needed phones. All the phones and computers needed to be networked with each other, networked back to us. We needed additional computer server and storage capacity. So it was a tremendous undertaking. Ended up costing us millions and millions of dollars, but the state, the city, and also UJ Federation stepped up and were our partners in this and supported the cost of the transition.
And as someone who's covered government for more than a decade now, I know that a lot of times getting money to get approved by the state and the city happens slowly. So how did you kind of fast track some of that stuff, and where were the state and the city, I guess, good partners in helping this take place and happen?
Well, people recognized that we wouldn't be able to say yes unless we could identify the sources of funding to support the transition. So people moved pretty quickly, to their credit. The state, the city, UJ Federation all convened special task forces, and we had a number of conversations about how they could support the transition. Ultimately, it happened pretty quickly.
Okay. Now that you have gone through this transition, you're probably the largest human services agency in New York City and in the New York City area. You have a $250 million budget now, roughly. This kind of brings up as a large organization, there's probably a lot of positives that come with it, but there's also some negatives that, obviously in the wake of what happened to FEGS, a large corporation that kind of fell together, there's probably a lot of nervousness by some people that nonprofit services are all kind of isolated into one organization as large as maybe your organization is. Maybe talk a little bit about that downside and that concern of a large corporation, nonprofit corporation, controlling so much of the human services, and ways that maybe you can make people feel a little bit more comfortable with the fact that the Jewish board is in control here, and maybe we won't follow the same path that FEGS followed as far as financially not keeping track of their books in a responsible way.
Yeah, well, first of all, while we're the largest, there are still plenty of other large, healthy human service organizations, Services for the Underserved, SCO, Children's Aid Society, so there's still plenty of colleague organizations. And one of the advantages of being large is that you have certain economies of scale that you don't have when you're small. So administrative overhead can be spread over more programs. We all know that both city and state contracts have reduced the amount of funding for administrative overhead, so it's important to be able to run efficiently. We're also all moving towards a world where our payers are going to be managed care organizations, not government. And their scale is very important. You need to be able to negotiate rates with managed care organizations. You need to be able to deliver services to large parts of the population. So having 5 borough coverage, being large, having a diversity of services, having services for both children and adults are actually, we think, going to be real advantages going forward.
And now that you are such a large organization, I think that you've probably just been trying to survive coming through, obviously, the transition and just get all of your ducks in a row. But now you kind of have an opportunity, I think, to probably expand out. So what would be kind of your ideas for expanding out your services now that you have kind of a larger organization and more purchasing power, things like that you can leverage to increase services in certain areas? Where's the focus going to be going forward?
Well, I think that we're done expanding for a little while.
Yeah.
As of this week, we took over $75 million of programs from FEGS, so we're good for a little while. But there are gaps in our service delivery. There are geographic gaps, and there are also types of services that we know we need to provide more of. But we're going to take a little bit of a breather after this transition is complete over the next 6 to 12 months before we think about expanding again past that.
But going forward, you are going to need to obviously revise kind of funding models, revenues, and maybe the amount of funding you get from state and city government. What message would you have for state and city officials who obviously helped you out with the transition, but going forward, you're still going to need their help? What message would you have for them to make sure that the funding is still there?
Absolutely. Well, FEGS is not the only organization, large or small, that has gone bankrupt or that is having financial difficulty. And I think that the city and the state are recognizing that their reimbursement rates for services may be too low. Of course, as an industry, we've been saying this for years, but I think it's easy to ignore or dismiss lots of advocates on the steps of City Hall or the steps of the Capitol building in Albany. I think it's a little harder to ignore when organizations, even large ones like FEGS, which were largely well-managed organizations for many years, when they start feeling the pinch, I think that makes people sit up and take notice. So I think you'll see a revisiting of some of the reimbursement rates for organizations. That's the single most important thing that city and state officials can do. An ounce of prevention is worth a pound of cure. It would have been much cheaper probably to help FEGS continue to survive as opposed to paying for the cost of the transition and the programs going forward.
Gotcha. Well, we'll keep an eye on this. David Rivel, CEO of the Jewish Board, thank you so much for joining us.
Thank you for having me.